I'm Dr. Rajat, and we've just concluded a surgical session of clinical implants training, and we have placed over 5 implants, and very planned, beautifully planned case by all the clinicians, and they have done excellently well. We've done immediate loading for our case, and we've done, in the morning we did a case for prosthetics and with multi-units, and I had a superb time with all of them. We have team by Lean, we have Joseph here with us, and we wanted to have his, yes Joseph, how did you like the whole setup, how did you like the whole training?
Basically the best thing about this training center that it's all in one, along with the X-ray you can remove during the surgery, the implants range is there, and the prosthetically which driven the implantology. It's amazing, like it a lot.
The idea is prosthetically planned implants and doing surgeries like you're doing it in your own practice. Exposed all the clinicians with live surgeries so that they become independent. They performed many implants, and I think now they are very confident. Yes, we'll start with Dhaval. Yes, Dhaval, the last module, the second last day, how do you feel?
I feel confident about implants now. Today I placed one implant. We have even seen the prosthetic part of implants. We have seen the indirect and direct method of impressions, and I feel confident about placing implants and even dealing with the prosthetic part of implants. I feel very confident, and it was amazing.
Being an orthodontist, he's learning different aspects of dentistry, trying to do implants as well, and really nice to see you pushing yourself into the horizons of implants. And what about you, Garvit? Kaisa laga? Being the left-hander, how do you like to have the whole setup?
Initially it was tough, but then the team cooperated with me, and I ended up learning the course in a very good way.
Yes.
So thanks to all of you.
So it was quite well planned, and Balpreet, he started with the case today, and he has already placed many implants, and I think he's very confident now too, and he's been focusing a lot, and he was the one who was supervising each and everyone's case, and so pretty good. Yes, Balpreet.
Yeah, this was a great experience, and once after joining this course and learning both theoretically and practically applying those points, it makes one confident to go ahead with the procedures when they are doing it on their own. So that confidence is given to us over here.
Perfect. Yes, Seema, she has been performing implant surgeries very well. She's very focused. And yes, Seema, कैसा रहा एक्सपीरियंस? अपने क्लिनिक में भी अब इनकॉर्पोरेट करना है, वो बहुत बड़ा चैलेंज है. सोचो कि हम सब साथ में हैं when you're placing implants, so it will be a great challenge. Now you guys are on your own to do implant surgeries. I have exposed you guys with different surgical protocols, different methods, different techniques, but the idea is just the same. Aesthetically, prosthetically, periodontically place implants and be confident, document your cases, make records, and that's how it is. कैसा लगा all the surgeries करके अभी?
Sir, बहुत ही अच्छा लगा. It's very good. Initially we were very afraid. Now by the end of the course, now we are very confident, and now we know how to handle the emergencies. So
Perfect.
I think will be.
That is very important.
Yeah.
It is a lifelong learning process. The more they are going to practice, the more they are going to face all the challenges, different cases. With implants, I always say that soft tissue grafting, perio, is very important. The focus is not on drilling, the focus is on prosthetics as well as grafting. So last but not the least, we have Mukhtar. He is all the way from Assam, and he has really done exceedingly well, and I have seen him doing very well from this day one. He's been focusing, especially with the sessions, with the case discussion. He was spot on. Yes, Mukhtar.
So today it was the last implant of this module, and today I learned a lot, especially using the asset kit and expansion of the bone in compromised cases. So it was really a good experience.
From aesthetic abutments to multi-units to temporary abutments to sinus lifts, bone augmentation, different surgical protocol, working with different systems, and I had a superb time exchanging and sharing knowledge with all of them, and I look forward with the bottom of my heart. I wish them all the best. So anything that you want to say? Hip hip!
Hooray!
Hip hip!
Hooray!
So cheers guys.
Cheers.
This is what we live for.